America's healthcare industry does have problems, but why don't people realize that a full-fledged government takeover of that industry is not the answer? Joining me tonight, the only physician who participated in today's hearing. It's Texas Republican Congressman and ranking member of the House Energy and Commerce Subcommittee on Health, Dr. Michael Burgess. Welcome to the show.
Good evening. Thanks for having me on. I appreciate you having me here.
So, let's talk a little bit about this. Tell me what your thoughts on the day's events and hearing.
Well, first off, I do need to slight correction. The Energy and Commerce Committee is much more powerful than the Ways and Means Committee. But you're right. This issue should have been heard in one of the authorizing committees. It was heard in the Rules Committee. I don't think that was an accident. The Rules Committee is the Speaker's committee. There are 9 Democrats and 4 Republicans on the Rules Committee, so the chairman of the Rules Committee wins every vote, 9-4. No surprises there, no suspense. But look, this is the Speaker's committee. I know she has a problem, or I think she has a problem with moderates and progressives within her caucus. That's understandable. But by placing this hearing in her committee, this elevates it. This means that this is what we're going to do. Don't check the weather, we're flying anyway. And I believe that that is, well, at least what I took away from that hearing late in the afternoon when the champagne corks were popping in the chairman's office. I think they've got this one and they've got it locked up. But look, you're right. The Vermont experience, you better be careful about how you set people's expectations. And taking away the employer-sponsored health insurance that people in this country have actually come to depend upon. I mean, look, some of the good news in the Congressional Budget Office last week was 2.6 million people more have employer-sponsored insurance because of the Trump economy. I mean, because of President Trump and what he has done.
Yeah, if you have more jobs and less unemployment, that's naturally going to happen. You still have people in this country who are uninsured, but I don't understand a federal statist takeover of health insurance in order to fix the relatively small number in terms of percentage of people who are uninsured. Why would you apply this massive, unaffordable program on everyone? I mean, one-size-fits-all insurance doesn't make sense in a group of people in the same family, let alone, almost 400 million Americans.
Look, they essentially followed that trajectory with the Affordable Care Act. And we've been told since the beginning of the year that Republicans are bad. You're always trying to harm Obamacare. Don't do it. Don't harm a hair on the head of the Affordable Care Act. And then we had a hearing today where they're going to entirely ablate all of the Affordable Care Act. Yeah. The entirety of Obamacare and all the subsidies.
You can't have
everything
it both
will be
ways. Gone. Either you hate it and it's awful and it has destroyed medicine and health insurance, or it's salvageable and it's the best option we have. You can't have it both ways. What is worse, herpetic bed bugs or Congress?
Well, man, I don't know. That's going to be a tough choice, wouldn't it? Look, yeah. I'll take a little bit of issue with Mr. Lewandowski who was just on. I was a regular person, a practicing physician. I made a decision to run for Congress after 9/11. There are good people in the United States House of Representatives on both sides of the dais. But this experiment that they're talking about doing with no cost-benefit analysis, no double-blind controlled trial, they are going to foist this on the American people, or that's their desire, to put this on the American people. This would be the largest single-payer healthcare system ever conceived. Even, you talk to the people in the European systems, there is no single European single-payer system. There's Britain, there's France, there's Germany. This would be unlike anything anyone has ever seen.
And they don't cover vision and dental, and people in Canada and Australia and the Netherlands, they have third-party insurance to cover most everything else. Bernie Sanders says you're only going to need extra insurance if you get a nose job. The whole thing smells, so maybe we need our noses cut off. Thank you so much, Congressman Burgess.
Thank you, Kennedy. Thanks for me on.
Absolutely.